Wellness for Life is brought to you by Perham Physical Therapy, Sanford Health Clinic and Same Day Surgery Center, Perham Area Community Center, Amy Lundberg, Fitness for the Soul, Gothenburg Chiropractic Clinic, Pelican Drug Health Mart, Mojave Ottawa Community Action Partnership.
Hi, I'm Dr. Armin Radke. I'm the optometrist at the Sanford Detroit Lakes Eye Department. And today I'm going to talk a little bit about macular degeneration. It's a subject that, especially with the returning snowbirds, are asked of me a lot, and we check a lot to see if there is any presence of macular degeneration. A little bit of anatomy, first of all. The macula is in the very center of the eye. It is not by the nerve of the eye. The nerve is our cable that takes the messages of what our retina sees to the nerve and to the brain, where the macula is the pure center that we see with, that has no vascularity or, in layman's terms, no blood vessels. That area of the eye is different than most areas of the eye because the blood that is fed to the macula percolates through the bottom of the eye to the macula, much like the old percolators that used to make coffee. So this percolation of blood is very important to maintain the health of the macula and allowing us to see clear. What happens that causes the macula to no longer function well is a number of different things. The biggest one is that we joke about here in the clinic is having too many birthdays. Unfortunately, age breaks down the eye, breaks down the function of blood vessels feeding the certain parts of the eye, and one is the macula. Other ones can be diabetes is a big one, trauma to the eye, smoking. Many of those things will cause the blood vessels to not work as well. And of course, there's many other possibilities of general blood vessel problems that can cause a lack of blood to the retina and the macula per se. What we can do to help the eye is first we have to differentiate between the two different types of macular degeneration. And I've heard a number of times stated that there's a good and the bad. Quite frankly, neither one are good. One is treatable, one is not treatable. The wet treatable is the type where the center of the eye, the macula, is swollen or distended due to blood vessels leaking into that area, causing the macula to no longer be a nice flat surface but bulging forward. When you see that, people see distortions in the edges of doors and lines and such. A dry macular degeneration is the type where the blood vessels dry up, the macula changes and degenerates, but there is nothing that can be done to treat that. Now, what we do here at Sanford is we try to do our best to first determine what type of macular degeneration the patient has, and secondly, what we can do to either prevent or help cause any further changes. The one thing we do is we give you this little home test. It's a test that you can take at home. You can put it on your fridge and look at it with a wink of each eye. If there are changes in this grid, then that tells us there are changes in the macula. That tells us that you need to return and see us as quickly as possible. The other one for generally help people is this preserved vision, or there's a lot of different ones, but the age-related eye disease 2 was a study done that allows vitamins to be analyzed to see how well they help the macula. And they have proven over 2 tests now that it is very helpful to preserve or try to prevent as much as possible. The third thing we can do, and that's for the wet macula, there is an injection that they will give in the eye through the bottom part of the eye, the white part, not the center of the eye, and inject what we call an anti-VEGF or a serum into the eye that causes the blood vessels to shrink and go away, and the retina then to return to its flat nature to allow for better vision. Those people that have that done realize that that type of a shot is sometimes done very often, like every 6 weeks. What's new is that there is a drop called squalene that may in time be a drop that you will take in between shots or many times before a shot is needed, and the number of injections can be reduced. So if you have questions about macular degeneration, make sure you stop in or call or ask. If you'd like to have one of these forms to take home, you can stop in and any one of the techs or assistants here can give you one of those to take home. Look forward to our next informative would be Dr. Quitberg and myself talking about cataracts.
Thank you for watching Wellness for Life, brought to you by Purim Physical Therapy, Sanford Health Clinic and Same Day Surgery Center, Purim Area Community Center, Amy Lundberg, Fitness for the Soul, Gothenburg Chiropractic Clinic, Pelican Drug Health Mart, Mojave Ottawa Community Action Partnership,